This session was entitled Infections, Outcomes in Pulmonary, which is a collection of really three different subjects, and they're combined. The majority of this session, however, focused on infection imaging. I think the most important points to take away from this session is that all of the presentations that were given on infection imaging made use of PET radiopharmaceuticals, which is the way that the field is moving. In addition to that, not only did the investigators look at diagnosing infections, they looked at the role of molecular imaging for monitoring response to infection, which is increasingly important because it would afford an objective, standardized way to evaluate treatment response, which is currently lacking. In addition to that, and finally, one of the presentations focused on an infection-specific agent for diagnosing infection. The agents that we have today are really best defined as host response. That is, what we're seeing on our scans and on our images are the responses of the host to the infection, not the infection itself. And again, a much better way to approach this is to have an agent that is specific for infection. In other words, that we are actually imaging the infection itself. I've been in this field now for probably close to 30 years in infection imaging, and what I've seen, and it's rapidly accelerating, is a focus on and the development of, number one, agents that are specific for infection. Number two, in agents that are capable not only of diagnosing the infection, but monitoring response to treatment and affecting patient management. I think it's an exciting field. It's important for us to remember or not lose sight of the fact that infection is the leading cause of death in the world, number one, and number two, that it is also the largest component of healthcare cost burden in the world.